Okay, here we have George, and he came to us about a month ago, and he had a lot of issues. He had a severe osteoporosis, which made his spine collapse, his lumbar spine, not only causing severe back pain in his pelvis area, but he had to wear a kind of full body brace in his upper thoracic and lumbar to stabilize him so he could walk and sit up straight. He had some essential tremors in his hands. And we decided to do some laser stem cell signaling. And 1 month later, what improvements have you noticed in George? Yeah, go ahead.
He has hardly any tremor. In the last 4 days, he has not worn his brace. He's walking better, slightly more upright. Doing a lot of walking. Yeah.
So George, the tremors, do you feel that they're a lot less than before?
Yes.
Okay.
A lot better. I have not seen hardly any tremors at all because I've been watching him.
Could you mimic how severe the tremor was on a bad day? Could you mimic that?
When he gets nervous, it's not all the time, Dr. Yu. It's not. It's when he gets nervous, he trembles a lot. Okay. So when he was asked to speak, I thought he was going to tremble. I thought he was going to fumble. I thought he was going to make mistakes. He made no mistakes, and he was laughing and joking. And I was like, oh my gosh, I was so apprehensive. I didn't want to make him look like an idiot.
Yeah.
But he was really good.
Could you mimic what it was like before with your hand? Okay. And while he was speaking, it was still, it didn't move.
He had the mic in his hand, so no, I don't think it would have moved. I've been watching him very closely with the tremors, so I'm just praying that they've gone, or almost gone.
For his spine, did they already do back surgery on his spine?
Yeah.
Yeah.
L1, 2, 3, 4, 5.
Yeah, they put all the hardware in there, right?
The titanium rods.
Yeah, and that did not solve the issue. It made him worse, correct?
No, Dr. Yu, no. It was to now we have to go back on the 23rd to see if it has gone like this.
Yeah, exactly. Yeah.
So because of his osteoporosis.
Yeah.
So we'll see. We don't know.
Now that the procedure, it's made his kind of torsolalumbar stronger. Now
I think so.
Doesn't need to wear the braces, the body brace as much, right?
Yeah. I think so. We're hoping that he doesn't have to wear the brace any longer. The doctor did say last time when we saw him, you don't have to wear your brace, but he chose to get that number one come straight up.
Great.
All
right.
So yeah, to me, I see a huge improvement. Now whether that has solidified or not, because
like I said, it's only been a month. George has had these spinal issues and the brain issues for decades. It's going to take a year to kind of rewire everything.
I think so.
Yeah.
I don't think he'll ever be straight, ever, because 30-year Navy and osteoporosis, that's like a miracle.
Yeah.
And degenerative joint disease along with it.
Exactly. Yeah. But I'm glad you're able to talk at the Navy reunion. People are going to like, hey, is that George, the former president? Because he's talking with such confidence now. Okay. All right. Well, George, I'm glad I'm going to call you Mr. President. It's great to have you with a lot less pain, more function, more mobility, more clear thinking, and, pretty much eliminated the tremors for now. We're going to keep on monitoring your progress. We're going to do a little laser to keep the cells stimulated and have you come back in a couple months for a follow-up, okay?
Couple of months. Dr. Yu, I just want you to tell you that he just started driving about a month ago.
Uh-huh.
And I was apprehensive for him driving up to Northern California, which was 4 hours. He drove 80 miles an hour and drove there and drove back.
Wow.
No problem.
Omar, you got that on film, right?
No, I stopped it. Let me get it again.
Okay, go ahead.
Hold on.
So I wanted to say, he drove to Northern California. We went up to past the Santa Barbara area, and he drove for 4 hours, almost like stop and start sometimes, but mostly 80 miles an hour. Coming back, most like 75% of the time was 80 miles all the way back home, and no problem.
no
He didn't
tremors,
have any pain.
No tremors.
No tremors,
he had
no
the
pain,
strength
no
to
nothing.
drive. And this is
Yeah.
right after the stem cell and laser.
I guess.
Because he drove after he had his treatment, correct?
Yeah.
Yeah.
Yeah. Because he wasn't driving before that. No.
Wow.
He was
Well-
driving, but only like around the corner, like 5, 10, 15 minutes in the car, and then back home, shopping, home, here, there, going out to dinner locally, but not like this huge drive. So I was apprehensive, I have to say. It's a lot for anybody. So, that was huge.
When did you take that epic trip after you had the stem cell
We
last
went on
month?
Sunday, came back yesterday.
Okay, wow. So within a month, he's able to get his driving skills back
Mhm.
after the treatment.
Well,
right.
it's just, I'm sure he had them all the time, Dr. Yu, but the doctor didn't think it was appropriate for him to drive his back, is like this. So we've taken all the precautions there are to take.
Yeah.
I have anyway.
Yeah, because George has a severe osteoporosis of his spine.
Right.
He has failed fusion hardware in there. It caused some neuropathy weakness in his legs. He had some essential tremors, but after the laser stem cell seeding last month, he's able to get his functions back. He could drive long distance. He's not wearing his back brace as much, and the tremors are not interfering with his functions, correct?
Yeah, I'm hoping that he only has to wear the brace just a little bit now. But
Yeah.
so far, even today, he came up, I said, "You're going to wear your brace?" And he goes, "No." So I'm hoping that he's not going to go back to the brace on a permanent basis.
So George, how did that drive feel?
Felt great.
How many hours was it?
What, 4 hours one way and
Three
three
coming
come
back. No
because-
When's the
traffic.
last time?